Go ahead.
Hello folks, how you doing? My name is Joe, and approximately 4 years ago I had a bad case of sinusitis, and I had several sinus surgeries done by, and at that time was an incompetent doctor, followed up by, he burned the inside of my nose with a laser beam. He burned what's called the right inferior turbinate with a defective laser beam, and he did damage to the nerves deep up inside my nose, called trigeminal nerves, a secondary branch of the trigeminal nerves. And since then I've been having electric shock pains at night, a very strange form, a bizarre atypical form of trigeminal neuralgia. It's not the normal type, which is pain on the face. My pain is these electric shocks deep up inside my head only when I try to sleep at night. And I had to resort to taking a very dangerous medication called Neurontin. Very dangerous. And the Neurontin, I don't know. I can't even. Why try to talk? I forget sometimes what I'm saying, what's going on in my mind, my memory, and everything, and that's all on account of the side effects of the Neurontin. And had I known that Dr. Tong had the ability to heal these damaged nerves and stop these electric shocks without this toxic substances that I'm taking to kill the nerve pain, I would have been here 4 years ago. But unfortunately, I didn't find out about him just up until recently.
So how did we help you? Have we helped you with the shocks here?
Yes, the level of the pain and the shocks has decreased. However, the worst part of it all is that one of the side effects, Dr. Tong, of taking the Neurontin and one of its secondary products called Lyrica, one of the side effects of it is I had two, possibly 3 Grand Mal Seizures, and which I never had a seizure before in my life until taking those psychotropic medications. When I had those seizures, I ripped apart my shoulders and I tore the rotator cuff completely off of my right shoulder and damaged the rotator cuff on my left shoulder during the seizures. Had I never taken the psychotropic drugs called Neurontin and Lyrica, I would have never had the seizures. So that's the shape I'm in right now.
Do you recall at a couple of treatments I gave you that your pain disappeared? The thing over here, the trigeminal.
Yes, there was one time when I came in for a treatment and I went home that night, and there was the electric shocks were gone completely. They were gone that night. Now they didn't. It didn't last that long because I didn't come back for more treatments. But it did last for a couple days. But I should have came back for more treatments, but I didn't.
Yeah, only cure your shoulder, and everything else had to be cured at the same time because they're all connected. So you come once a week, there's a chance that I can cure and also establish your mental ability back.
Okay.
And the deafness too. Tell us about your deafness.
Oh well, ever since again I started on taking that's the psychotropic painkiller with their nerve. It's for nerve pain. See, there's many different types of painkillers, opiates, and things like that, but none of those affect the nerves. The only type of medicine that kills nerve pain are anti-seizure medications, and one of the side effects in addition to the seizures that I've had is that I'm starting to hear voices now. I'm hallucinating hearing voices in my left ear where I'm deaf, and I never heard those voices before until I started taking the Neurontin, and it seems to have been a cumulative effect where it's destroying my mind and my memory and my thought process, and I don't know what to do.
Were your left ear deaf before you took the Neurontin?
Yes, but I never hallucinated any voices in it until after taking Neurontin.
So now you can hear from the left ear.
No, still can't hear.
But the hallucination.
No, only intermittent hallucinations of voices that they come very fast. I don't understand what they're saying. They speak very quickly, and then they go away. And at the same time, I feel a burst of the Neurontin feeling inside my mind at the same time that it happens.
How about your right ear? How's the hearing?
My right ear is slowly going deaf.
After the Neurontin or before?
It seems to have accelerated after the Neurontin.
Okay, today I'm going to treat your right ear and see whether I can restore some hearing back, okay?
Okay.
Okay, let us see you move your shoulder.
Okay.
Move it up. It hurts right there.
Yeah, there's pain.
Okay.
Torn rotator cuff.
Okay. Okay, now we have treated you for the tinnitus. How do you feel about the tinnitus now?
Tinnitus, it appears to, I can't say for sure yet, but it has improved a little bit. I don't know how much yet until I go home.
No, the tinnitus. You still hear the tinnitus?
The roaring sound is gone.
Okay, Joe, now you have the tinnitus treatment. So how is the tinnitus now?
The tinnitus is better, definitely better. It's decreased by about, I'd say about 70%.
You still hear a roaring sound?
Very little.
Very little.
Very little.
Okay.
It's decreased about a good 70%.
Okay. So the hearing is still have a little problem?
Yes, hearing is still a problem.
No improvement yet?
No improvement, not yet on the hearing.
Okay, but the roaring sound is gone.
The roaring sound is gone, yes.
Okay. Now let's see, I also treat your shoulder. Let's see you move your shoulder. Move it a little faster. Okay, now you have no pain. So the rotator cuff is a mystery. I mean, it's a myth. You feel any pain?
Yeah, no, it's about 80% improved. The pain is 80% gone.
Yeah, move a little faster. So you could not do that before.
No, I couldn't do that
very
before.
Very painful before.
Yeah, couldn't do that before.
See, if you learn how to eat right and alkalize yourself, then this will maintain. Right now you're too acidic.
Okay.
Let's see you move a little more. Move it like a normal. Yeah, see? You don't be afraid to move. Just don't lift anything heavy at this point.
Okay.
Yeah, when you more, then the muscle will grow. Then you can lift things like before.
Okay, just take it easy for a while.
Okay, how about I also treat your sinus? Breathe through your nose. Do you feel any different on the head?
Sinus is fine.
Do you feel any difference than before? Is that more clear?
Yes.
More clear, right?
Yes. Sinus
Okay.
is more clear.
Okay, yeah. I also treated you for the sleep and your nightmares.